Kara. My name's Taylor, and I'm going to be your nurse today. How are you doing today?
I'm doing all right. I've been experiencing a lot of coughing fits lately.
Oh, really? Coughing fits? Can you tell me a little bit about that? Like, how often does it happen? How does it make you feel?
Well, it's kind of like a dry cough, always really dry. And it usually happens after I have a cigarette. It's like I sort of lose my breath and I feel the urge to cough, and it kind of just like keeps going, and I
Oh,
can't catch my
wow.
breath.
Okay, so this tends to happen after every cigarette that you smoke, and you kind of lose your breath a little bit?
Yeah, exactly, and it's really uncomfortable.
Oh, wow. Okay. Well, now would actually be a really good time to bring up your smoking. I was looking through your chart and I noticed you did smoke. And you've been having these coughing fits, and I kind of want to get to the root of that. Would it be okay to talk about your smoking right now?
I mean, I guess so. I guess it wouldn't hurt.
Okay, great. Thank you. So how many cigarettes do you usually smoke a day, do you think?
About 2 packs a day, maybe a little more. It kind of just depends on how I'm feeling.
All right. So a pack a day, and how long have you been smoking for?
Since I was about 14 years old.
Okay.
Yeah, and I guess about 2 packs a day ever since then. I mean, all my
Okay.
friends did it. So.
Okay. So can you tell me a little bit about why you like smoking exactly?
I don't know. I guess it's maybe the way it tastes, and it makes me feel good. I'm less stressed after it, so.
Okay.
And I've had a history of depression, so I mean, it definitely makes me feel better after that.
Okay, so you really like the way cigarettes taste. It seems to be a good stress outlet, and it kind of helps with those depression symptoms.
Yeah, it's definitely helps with that, and but most of all, it's the best stress reliever that I have.
Okay. Well, is it okay if we go kind of a little deeper into the subject of your smoking?
Sure, I guess that would be all right.
Okay, great. Thank you so much. I know it can be kind of rough talking about this. So you stated that you smoke about 2 packs of cigarettes a day, maybe a little more, and the amount that you are smoking is above the safe limits. So I'm just a little concerned about your health, and I think that could be kind of the trigger of that cough you've been having, actually. What do you think about that?
Well, I guess I didn't really think much of it until now. I didn't know that that was a lot to smoke. I didn't realize. All of my friends smoke way more than I do, so I thought it was fine.
Okay, yeah, I mean, that is actually a large amount that could be affecting your health a little bit. Is there any way that smoking affects your friendships or your relationships and family or anything like that?
I mean, well, I have a niece that I really adore, and I like spending time with her, but my brother, her father, won't let me spend time with her when I have to smoke because he doesn't want to make her put her around those situations. So that kind of hurts my feelings, and I feel like that really affects my relationship with her.
Wow, okay, so it definitely seems like you recognize that, this is something that's really hurting you and the relationships in your family. Is it okay with you if we do a little exercise where we kind of talk about the pros and the cons of if you were to keep smoking, and then the pros and the cons of quitting? Is that okay?
I think that would be all right.
Okay,
Yeah.
great. So first off, tell me some of the benefits that there are for your smoking if you were to keep doing that.
I don't know. I guess the taste, and I like the way it takes off some of my stress, definitely, as I told you before. I guess I like because all my friends do it, and that's just kind of a way that we bond, I guess.
Okay, so you like the taste, and of course the stress relief, that seems like a big part of it. And then it also kind of seems like a big social outlet for you as well.
Yeah, that's about right.
Okay, so now can you kind of tell me some of the bad things that, if you were to keep smoking, what would those be?
I don't know. I guess it's pretty bad for your body and definitely for your lungs. I mean, my dad passed away when he was in his 60s from lung cancer, so, I mean, it runs in my family.
Wow.
I mean, I think it may be giving me this cough, as you said, so that's not good, and I spend a lot of money on it per week, so that definitely plays an effect.
Okay, so basically the downsides are your health, that cough you've been having, and your dad died of lung cancer, so that can be kind of a sad thing that could affect you maybe in the future. And then the expenses, definitely it can get kind of expensive. And then, yeah, that horrible cough. So can you tell me some of the benefits if you were to quit? What would some of those be?
Well, I guess if I were to quit, I would save a bunch of money, so that would be nice. And I would get rid of this horrible nagging cough, which I would be really looking forward to. But I guess that's pretty much all I can think of right now.
Okay, well, so it seems really important to you to get rid of this cough.
Definitely is, yes. It's so miserable. I would almost do anything to make it stop.
Yeah. And so lastly, what are some of the drawbacks if you were to quit?
Well, if I quit, I think it would be really hard just because I've been doing it since I was 14.
Mm-hmm.
It's such a big part of my life. I'd probably lose some of my friends or not be able to hang out with them as much just because that's just what they do.
Mm-hmm.
And I might also gain a lot of weight. I heard that that's something that happens after you quit.
Okay, not with everyone, but some people do experience that. But have you ever tried quitting smoking before?
No, I haven't. I've never considered it. Like I said before, I've only been smoking since I was 14, so I mean, it's just been a big part of my life, so I can't
Okay.
imagine anything else.
Well, if it's all right with you, I'd like to offer you just a little bit of advice if you're okay with that.
Sure.
Okay, well, based on what you've told me today and what we've kind of talked about, your dad's, who he passed away from lung cancer and this cough that you've been having, I think it would be a really great idea if you would maybe want to cut back on your smoking, maybe to a pack a day or, kind of set a limit for yourself. Would you be willing to kind of talk about this and kind of try that?
Sure. I would like to.
That's fantastic. So I have here a scale that kind of shows your readiness to quit, and from a scale from 1 to 10, and so 1 would be that you're not willing to quit at all, you're never going to quit, and then 10 would be that you're actually willing to quit today. So where do you think that you would fall on this scale?
I guess it would be a 10.
Wow, that's great. So why a 10 and not a 7 or an 8?
Well, because we've talked about how it could, how smoking negatively affects my health and
Yes.
how I'm already at risk for developing lung cancer. And if I do smoke, then I would be able to spend more time with my niece, which I would really enjoy.
Yeah, that's fantastic. So, a great thing that people are doing nowadays is they're setting a quit date for themselves. Would you like to learn more about what a quit date is?
Sure, I don't see why not.
Okay. So basically, a quit date is a date that someone will set for themselves to actually quit smoking. So it doesn't have to be today. It can be tomorrow. It can be a week from now. It just kind of depends, what works in with your schedule, when you think you'll be ready. And it's also really good to hold yourself accountable. You can tell your friends, you can tell your family, so that way you'll be more apt to actually stick with it. Do you think you'd want to set a quit date today?
Sure, I don't see why not.
Okay, great. Is there any certain date that sticks out to you that you kind of think that's the day?
Well, maybe about a week from now would work best for me.
Okay.
I kind of want to give myself a little time to prepare for that, and I think a week from today would be great.
Awesome. So next Monday is your quit date.
Okay.
Can you think of any ways that could help you through this quitting process?
Well, maybe if I would be able to spend more time with my niece and
Okay.
take her to the park and do activities like that, it would probably help
Okay.
get my mind off of it.
Great. No, that seems like a great outlet to replace that smoking with. Have you ever considered, have you ever heard of the patches and the nicotine gum that they have? Would you consider that?
I've heard of the patches and the gum. I heard that they have a pretty good success rate. I'd be open to trying that, I
Okay,
think.
great. Well, I'll definitely ask your doctor about that, and I'm really glad that we've met today. I really want to get this cough alleviated for you, and I'm really glad that you decided to set your quit date. You'll have to let us know how that goes.
Okay, I will. Thank you.
Great. Do you have any other questions for me?
Not right now. Thanks.
Okay, well, good luck with the rest of your day, Kara.
Thanks.